The academy has been very interesting, I must say. Having interacted with DHIS2 in my work at the Zambia National Public Health Institute, I can confess to say some of the charts that we learned about, and most of the work we did actually during this academy, I have not interacted with until the academy.
Well, the academy has been a great experience. I learned about the new features of data visualization, which are exciting for us. Especially, we've seen that some of the new features that have been introduced can be used for disease surveillance as well as outbreak monitoring and also outbreak investigation. For instance, there's been an introduction of period SAT scan analysis in the maps, where we are able to plot the maps over a period of maybe 6 months to show each month how, for us to be easy to show how an outbreak is evolving, which areas are being affected. That feature has stand out well for us. Also, the issue of slideshows for a dashboard has really stand out, because it will make presentations easy when we are presenting our dashboards during our incident management meetings. Also, a number of enhancements in charts, a number of enhancements in the Maps app. Those are really what has stood out for me, and we intend to use them effectively during our disease surveillance and outbreak investigations.
The key takeaways, or what really stood out for me, were the new updates in the system, which are the apps and the apps and the other new inclusions, the dashboards, the layouts. So the new charts, we learned about the charts, the layouts, but what really stood out for me are the new updates in the system. I think that has made the system to actually be more easy to use. This is actually practical and actually be beneficial to us in terms of tracking or monitoring conditions or diseases. When you create the dashboards, it's easy for us to view the performance, as well as monitor progress on how we are performing, just tracking monitoring indicators. So which will also help out in decision making.
So it will be very, very interesting going forward during work to utilize the different charts that actually exist now that I have learned how to use them. But also, interestingly, we have dashboards that are used to present data during what we call public health security meetings, which are held every week. And colleagues have been struggling with those presentations, because the dashboards, the ones that we are using now, don't have the features that we now have, where you're able to put them in slideshow, for instance, and then you play them as you present. But that's one important feature that I believe we're going to utilize very well, and it's going to really help with those presentations.
It was important for us to come and see what is new in DHIS2, to see what is new in the charts, what is new in the Maps app, so that we can take it to our sub-national levels for them to effectively analyze their data, and also for them to do their geospatial analysis using DHIS2.